Thank you very much. Good evening, everybody. Thank you for the invitation. Right, as Dr. Aaron has said, we are very pleased with what we have got for the past 1 year. So it's like a new toy to us. We are very excited about the usage and also the result. More so the result for me because as Dr. Aaron again has mentioned that we have our own physiotherapists. I have a group of 20 people working with me in my center. So we actually have the luxury of people to look at some of the result. Since we are almost 1 year down the line, we actually follow up quite about almost 60 to 70. A lot of patients in Malaysia, after they have got okay, they actually do not come back to see us. So firstly, I'm to thank Jeff and everybody for this session, and also my center, DSmart, for helping me to come up with some of the results. Right. So when we do an ACL reconstruction, our problem is always donor side morbidity. Sorry, the spelling. Pardon. Okay. Donor side morbidity is one of the big problem, right? So we always have problem with hamstring. If you take from hamstring, right, we will have pain, and then you will have shortening of the hamstring. We have problem in extension. Because of that, you have problem with quadriceps being unable to be mobilized and also strengthened, right? The site of the graft, right? So like in Malaysia, we have a lot of people, Muslim people, we have problem with people who take the graft from the anterior, and then they have problem in prayers and so on, especially for Muslim. The speed of recovery is actually a very important thing because we see a lot of athletes, right? They need to go back to their livelihood. They need to earn money for living. So we need to get them back to game again and return to sports, right? Return to sports actually is very much a lot of patients after ACL reconstruction, right? Prior to our studies or prior to having my own center. So we see only 20% of people going back to sports again. But now we have able to thankfully bring almost like 80% of patients back to that level of sport that they left during their injury, right? We know the source of graft that we have. I have problem. I do not use allograft because I had bad experience with allograft, right? That's why I'm very happy that we have synthetic now, right? You know, when you take a hamstring graft, you have problem in incorporation of the graft. It's slightly longer as compared to the bone patella bone, especially on the bone to the tunnel side. But it doesn't really matters, right? So slightly lower rehab, but donor side is a problem. So there will be tightness of the hamstring, weakness of the hamstring, therefore causing extension leg and also hamstring and quads weakness. So if you all have taken enough hamstring, especially if you take both the semi-T and also the gracilis, then you probably have patient who has experienced pain and pop sound over the hamstring during the rehab, especially the first 6 weeks. That causes a lot of problem for patients, and then pain, and then you actually derail your recovery, right? So what we have been doing, right, is a hybrid graft. I call it a hybrid graft. That means the artificial graft, which is Artilon, and then with semi-T, right? I do not put my graft, sandwich my graft for inside the semi-T. So I actually sometimes sandwich the graft outside. So I don't think so it really matters whether your Artilon is outside or inside or something like that, right? What we have seen is that we saw faster recovery. We have definitely less donor morbidity, comparatively less inflammation, and definitely it support ingrowth of the donor, the host tissues. So what we have done is I do a lot of ACL. We did about, what we can find out is about 39 patients for the hybrid, and also 50 for the hamstring. So this hamstring is prior to year 2020. So this hybrid is the recent. So I have about almost like 55 ACL. Out of these 55, that is about 7 of the revision. So 3 ATFL reconstruction, 6 MBFL, and then we have 2 Achilles tendon reconstruction augmented with Athlon. So what I'm trying to present here is only our ACL cases, right? So we are able to get almost like 39 patients from the hybrid over the past few months, right? Majority of these cases have passed 6 months, right? Therefore, we are able to follow up almost like 70% of them, right? There were 39 hybrid, that means semi-T and Athlon. Out of these 39, 34 male, 46 on the only hamstring side. When we say hamstring, that means it is both the semi-T and also the gracilis being used. So majority of these patients who are sports injury, left-sided injury, mainly because they are right-hand dominant. Okay, what we look at is we measure the patient's dynamometer. If you're not sure about what dynamometer is, it's a device that look at the strength of the patient individual muscles measured against resistance, right? So it will give you a certain amount value in kilogram. Right. Also, will measure the patient myofeedback level. The biofeedback is a device that we see the activation of the muscles. So for purpose of time, I'm only going to concentrate on dynamometer. So the biofeedback test is also showing very encouraging result for the hybrid group. So what we are having here is 2 groups. So we are looking at the quadricep and also the hamstring, right? So we actually have a follow-up of three times that we measured them, right? We measured them many times, but this is the time that we measured them at the pre-op, 3 months and within the 3 to 6 months, right? So on the left side of the screen, we have the difference, percentage of difference of the of the quadricep, of the operated leg and the non-operated leg. So the operated leg, right? We have the difference in hamstring. You can see that the quadricep for the hamstring pre-operative is fairly normal, right? So you can see the difference within the operated and non-operated leg. So each of these bars represent the difference between the operated and non-operated leg. For the hybrid side, is only about 13% of difference. For the hamstring, right, semi-T and also gracilis is 21 to 22%. So after 6 months, we have noticed that there is a difference as well. So this difference is for us significant because we can actually get the patient back to rehab much faster than before, right? If you look at the hamstring where we take the graft from, right, the starting off point is almost not much different. So you see there is almost like a 20 to 25 to 25% difference, 30% difference of strength of the between the hamstring and the hybrid, which also means for this graph is that the hamstring is less affected on the hybrid side. At 6 months, right, there's still a 10% to 15% difference. So even when the patient graduate from our rehab site, there is a difference of almost like 10 to 20% in some patients, right? So we are able now to get the patient back to game, to rehab and all these things to their normal activity much faster than before, almost like 30% faster. We also look at the fitness. We do their strength training. We do the strength. If you look at the timeline, all right, the hybrid side for the quadricep, after 6 months, we still are better. As time goes on, the hamstring will get better, right? The hamstring side will get better. They will catch up, but the thing, there's still a significant difference, right? Right. This is a leg press, and then this is a leg curl. So there is a difference at 6 months, right? And then because our number of hybrid is not as high, so we and also a lot of our hamstring patients are all more athletes of high caliber. That means they are, some of them are national athletes. We can see that the difference are not much. But if we were to have a longer follow-up, I'm quite sure we're going to see much more difference. Right? For the MPFL, we have 6 patients. Out of these 6 patients, right, one of them is a hamstring, right? And 5 of them are actually, we are using Artilon. So if we look at the result, right, the difference in the strength for the VMO when we do a dynamometer, so the difference for those using hamstring is very high, even at 6 months, right? So there's a difference of right and left 69% as compared to the Artilon, which is only about less than, and this is at 3 months, sorry, less than 50%. The Artilon patient definitely function faster and better as compared to others. Sorry, there's a lot of data here, but what I'm going to say here is the right and left, the operated leg and the non-operated leg is actually different, right? As you compare to those hybrid and non-hybrid, right? So we then interview all the physiotherapists as well, right? What do they think of Artilon, right? At the time when they do the physiotherapy, we notice that there's lesser extension leg. Thus, the VMO is able to contract, improve at a much faster rate. So at 2 weeks, right? Normally, it takes about 2 to 4 weeks the VMO is activated. This we can actually, in some of the patients, immediately you can get the VMO to be activated. They can actually bounce their VMO, we call it. Knee flexion, range and motion is much better, almost 2 to 3 weeks earlier, right? Artilon compared to Autograft. They are off crutches 2 to 3 weeks earlier, right? And less knee pain, less swelling as well. So they can actually extend their knee much better. And by doing that, their quadricep can be activated better and their hamstring can be stretched better as well, right? Post-op recovery, when we interview our rehab therapists, right? They have found that from their data that less hamstring strength related issue. That means if you have used Artilon, there is a 4 to 6 weeks earlier. So you can actually function much better 4 to 6 weeks earlier. Especially when you have hamstring problem, you cannot extend, you walk funnily, you are unable to extend your leg, you still walk with a slight limp, right? So here we have a month and a half that they walk much better, faster, right? They go back to work, to games, also to jogging even faster. Anterior knee pain, so somehow there is less anterior knee pain in Artilon as compared to hamstring Autograft. Knee flexion of range of motion. So Artilon, we are about 2 to 3 weeks earlier. Overall smoother recovery. So they can actually do a single leg squat much earlier as compared to the Artilon side as compared to the only the Autograft semi-T. Return to sport, right? I think we don't have enough data for this, right? So very few of us, very few of the patient, almost like, I think about 70% of them who pass 6 months to claim for the rehab, only about out of 35, right? Out of this patient, only about 71% actually go back to games again. But we are expecting in Artilon, we are able to get almost like 80 to 90% or back to games at 6 months, right? We haven't got enough result yet. We haven't got the ELISA test. I'm quite sure you all know about the advanced lower extremity sport assessment. This is an assessment that we look at and see whether they're really okay for games or not. So in conclusion, I think that the dynamometer test, fitness test for all these hybrid are much better than the hamstring, almost 20 to 30%. Hybrid graft shows a positive result due to mainly the problem of less problem with the donor side. Right, I think we need longer time for this study, right? So we are not complete yet. So that's why we don't have enough data. What we have now is at the moment, we just finished this study just 3 days ago. And we are not finished yet. We just get whatever we want. So I think it is a positive result that we have. We are able to get the patient back again, and then less problem, less pain, less less inflammation and so on. Okay, thank you very much.